Member for Reid.
Thank you, Mr Deputy Speaker. February 2023 marks the 39th anniversary of the introduction of Medicare by the government of Prime Minister Hawke. Australia's healthcare system is based on equitable and fair access for all Australians. It was in my maiden speech to this parliament where I spoke about how our healthcare system is based on fair and equitable access for all. Our hospitals, for example, including those in my region, Gosford Hospital and Wyong Hospital, are a place where it does not matter who you are. It doesn't matter where you come from, and it doesn't matter the circumstances that lead to your presentation. You will be cared for, and you will be cared for free. And that's due to a hard-fought Labor initiative that saw a little green card come into the lives of all Australians. And a little green card with the words that represent universal access and complete access, Medicare. And this is only going to improve with the introduction of our urgent care centres, in which my electorate on the Central Coast is receiving one. We are creating a new model of care in Australia, which is seen and which is established right across the world in different nations. Access to care if you are too sick to see the GP or not sick enough to see the emergency department. A service that will treat adults, a service that will treat children, a service with extended operating hours, and most importantly, a service that will be bulk billed. This is part of our promise, the Albanese Labor government's promise to strengthen Medicare and improve access to medical services. A major issue that I see in the emergency departments on the Central Coast is the rationing of medications, meaning that patients are taking their prescribed medications every second day, every third day, every fourth day, sometimes once a week. And this is all because they've been unable to afford their prescription medications. And I can think of multiple clinical examples of where this has been a significant issue. So let's take a patient who's taking a blood thinner, a Pixaban, which is Eliquis, in an attempt to prevent a blood clot causing a stroke, secondary to an abnormal heart rhythm such as atrial fibrillation, all very common conditions throughout our community. Patients would only be taking their medication infrequently, and therefore this condition would lead to that patient presenting to the emergency department with a significant physical deficit, inability to use their arms, inability to use their legs and walk, inability to see, inability to swallow, inability to talk. And this is because of a stroke. I think of patients with type 2 diabetes mellitus presenting with several complications secondary to consistently elevated levels of blood sugar, including blindness because of damage to the retina, kidney failure requiring dialysis, damage to the nerves in the extremities, and issues with the blood vessels in the legs, leading to wounds which get infected, and then those limbs then require amputation. I think of stroke, I think of coronary artery disease and heart disease, just to name a few. And these are only two examples, because the patients were unable to afford their medications. So they would ration them, as I said, every second day, every third day, once a week, sometimes not take them at all. And these are two examples with patients who have chronic diseases where the sequelae is preventable if the medications are taken on a regular basis as prescribed by their doctor. And I'm proud to be part of a government, this Labor government, that is improving medication access for millions of Australians, including thousands on the Central Coast. As of the 1st of January 2023, the government will have reduced the cost of pharmaceutical benefit scheme co-payments by $12.50 to a maximum of $30. This is not only a cost of living measure, but it's also a measure that will prevent unnecessary trips to the doctor, unnecessary presentations to the emergency department, and it will ultimately save lives. Thank you, Mr Deputy.